This is a special meeting of the Board of Health limited to the two items on the agenda. I'd like to call the meeting to order. And is Angela here to talk to us about stats?
She is, Dr. Stars. I'll just read off the introduction before we start the meeting. So this is the Special Board of Health meeting dated May 19th, 12:30. This meeting is being held by Zoom in accordance with the best practice guidelines that have come out from the governor's office. The meeting ID is 890-6360-8044 with a passcode of 766989. Participants can join this meeting by telephone. The phone number 616-468-769923. If there's any problems that anyone has with the audio, they can dial 603-821-2049. This meeting is being recorded.
Okay. Now, do each of us have to say we're home alone? Is that already taken care
of? Yes, the board members should say for the right to know where you are, state your name, where you are, and if you can hear the proceedings.
You're right.
I am Tony Soros. I'm chair of the board. I am home alone and I can hear you. Maybe or maybe. Can we get people to mute out, please? Thank you. I'm home alone and I can hear you all. Thank you.
Oh, hi, this is Chuck Capetta. I'm at my office on 2300 Southwood Drive in Nashua. I'm in a conference room by myself and I can hear everybody.
Stephanie? Bobby, Stephanie on board? Bobby, you're muted.
I'm sorry, I don't see that Dr. Rosenberg has joined the meeting as of yet.
Okay. That being said, is Angela here to give us the stats that we need?
Yes.
Thank you.
Good afternoon, everybody. Angela Constantino, epidemiologist. So for our situational update today, as of today, we have 164.2 million cases worldwide. 32.9 million of those are in the U.S. with 587,000 U.S. deaths. In regards to community level transmission here in Nashua, we are currently exceeding 1 out of 2 indicators that push us into substantial transmission. So for our incidence rate, which is still considered substantial, we've had 209.3 new cases per 100,000 people, which is down about 5 standardized cases compared to last week. Our percent positivity rate has stayed about the same over the past week and is in the minimal transmission category. So in the past week, there has been 282 tests conducted on average each day in Nashua, and 13 of those tests have been positive each day, which gives us a percent positivity rate of 4.8%. This is compared to the state's rate of 2.9%. In regards to our case activity, there are currently 8,004 cumulative cases in Nashua. Of those cases, approximately 96 are currently active and infectious. We've had 6 additional reported deaths in Nashua over the past week and a half, for 93 total deaths and a case fatality rate of 1.1%. Our hospitalization rate in Nashua is at 2% compared to the state's rate of 1.4%. And then in regards to the state as a whole, there's been a total of 97,904 cumulative cases in New Hampshire, 1,116 of which are currently active. Last week in Nashua, we had 90 new cases, which is down about 9 cases compared to the week before. So over the past week, we've experienced about a 9% decrease in new cases. Case activity in Massachusetts continues to decrease. They have 12.7 thousand active cases, and they're seeing less than 500 new cases a day. And then in regards to the rest of the country, all states continue to see a reduction in their curve, with the exception of Alabama, who jumped from about 300 cases a day at the beginning of May to now about 2,000 cases a day. In regards to the variants in New Hampshire, the majority of our variant cases remain B117, about 42.3%. This trend is also being seen throughout the rest of the country. 6% of our variant cases are P1, 0.3% are B1351, and 6.7% are B1427, 429, which is a variant of interest from California. And then the remaining 44% are variants of other lineages. B1617, the variant circulating in India, has been classified by the CDC as a variant of interest and accounts for about 0.7% of US variant cases. But B1617 has not yet been identified by the CDC in New Hampshire. In regards to vaccination, as of yesterday, 35% of the total national population has been fully vaccinated, meaning 1 dose of Janssen or 2 doses of Moderna and Pfizer, and 48% have received at least 1 vaccine or more. For comparison, 29% of the total Hillsborough County population has been fully vaccinated, and 43.7% of the entire New Hampshire population has been fully vaccinated. And that's it for my update. Thank you.
Thank you, Angela. I'd also like to recognize Dr. Stephanie is on board. Welcome. And also the various aldermen that are signed in. Okay.
And also, Dr. Sturz, Attorney Steve Bolton is also on board.
Oh, there he is. Hi, Steve. I'm sorry I missed you. Moving forward, start discussion. Stephanie, since you're the farthest away, you get to go first. You're on mute, Steph.
Can you hear me now?
Good job.
So the main agenda item today is to discuss the mask mandate and what recommendations would come from the Board of Health in light of the CDC guidelines and in light of the statistics that have been presented to us. So we have sufficient information about vaccinated persons to know that people who are fully vaccinated, with a proviso that it's 95% effective, are safe to go about without masks. We also know that there are certain federal mandates that include things like transportation, where masks are required independent of vaccine status. So the main point of discussion today is to determine whether we would like to advise or recommend to the Board of Aldermen that the present mask mandate be lifted in favor of an alternative and in line with the CDC guidelines. So at present, the CDC guidelines do recommend that unvaccinated persons, I just heard an echo. Can you hear me without an echo?
Kind of on and off.
Okay.
Keep going.
That unvaccinated persons can be safe to go without masking. Vaccinated persons can be safe to go with unmasking, but unvaccinated persons should continue to wear masks, should continue to socially distance, and that when people are with those who are of unknown vaccine status, of potential immune compromise, should continue to wear masks. And so one recommendation is that the present mask mandate in the city of Nashua be lifted, but that there be several provisos regarding this lifting of the mask. So, and again, this is for discussion and based on the CDC guidelines and the science. A lifting of the mask mandate would mean that in outdoor environments where people are able to distance, that masks would not be required, and that unvaccinated persons should continue to wear masks, but that in general, the mask mandate would be lifted for outdoor venues. I am of the opinion that indoor environments should remain masked. And if the Board of Aldermen choose to follow the CDC guidelines relative to lifting a mask mandate outdoors, but to not retain an indoor mask guideline, that businesses, religious institutions, offices, and others should be advised to continue the mask mandate indoors, and that they should be allowed to make their own decisions, independent of what the final recommendation is from this body, the Board of Health, whose mission is to protect the health of the citizens. It is my strong recommendation that the Board of Health provide guidance. There are great graphics on the CDC website as well as the state website to advise persons to continue to wear masks for 3 reasons. One is because the vaccine is not 100% effective. The second is that there are mutations. And the third is that in the absence of green passports, so-called green passports, or understanding what people's vaccine status is, in indoor environments, you have to assume that there are unvaccinated persons. So those are some general guidelines that I provide to you.
Thank you, Stephanie. Chuck. Chuck, you're on mute.
Yes, hi, good afternoon, everybody. Thank you, Stephanie, for a well-rounded summary of the details, which is a complicated thing that, as we all know, has been changing daily, if not by hour. And I think, the science has been our driving force here. And so I too share the sentiments of outdoor masks in fully vaccinated people seems reasonable given all that we've learned to be lifted. That seems to be a no-brainer, right now. The gray zone, I think, and I think this is where we're going to get the discussion points about internal meetings, or, in case businesses, how to prove or disprove this vaccination status. I don't think we're at the state of having a vaccine card. I don't think we're at the state of really asking our patrons as they walk in the door, show me your status and tell me what you are. I think that wouldn't go over well either. So, but I think if individual businesses have, because they own the business, have a right to say this is what we feel, and for the reasons they state them, and a policy, that I would be in favor of that, and welcome further input here. I think we've come a long way, but the fight is not over. I think that the rush to close this and be done with it is my fear. And I know there's a lot of people on the line. I love to see all the faces here. There's a massive amount of people listening, so I don't want to hog the time here, airways, but, I think the race is not over, and it's still, up to us individually to own this, to respect each other. And the whole point of masks, as we stated from the beginning, is as I walk into a patient's room, I wear a mask and I say, I'm wearing it to protect you. I'd like to have you think the same for me if you wear that mask. And so, that's a different topic, but, I think we just have come a long way, but still a little tweaking to be done. Thank you.
Thank you, Chuck. I'd also like to recognize Dr. Alex Roddick, who's a vital input to the board. So, Alex, would you like to add or modify?
Yeah, I think I would agree with what's been said. The difficulty, and I think everyone's aware of this, is that to allow people to be without masks, especially indoors, is kind of a leap of faith. You have to trust that everyone who is not wearing a mask is truly vaccinated, and that people who are not vaccinated are going to wear the mask. We know from human behavior that that's not going to be true for the most part. So I would propose that, as Dr. Capetta said, individual business owners should have the ability to decide for their own business whether they're going to require all patrons and employees to continue to wear masks in the absence of being able to check their vaccination status. I know that some businesses in certain parts of the country do have, perks if you show your vaccine card or you can prove it. Although the state doesn't have necessarily anything set up that way, most people do have probably the ability to produce proof of vaccination. So whether we would say, if businesses want to accept that, then they could allow it. In many ways, it's just simpler to do kind of an all or nothing thing. You either require people to wear masks in a business, or you don't require it, but people can still wear masks if they so choose. So that's probably what I would recommend. I would still recommend that the language in any change to the city ordinance be clear that in certain environments, such as public transportation, healthcare settings, perhaps shelters, correctional facilities, that the masks are still required. Even indoors, even with vaccination, everyone should still be wearing masks in those settings. We've talked about, is there a level at which we should reevaluate this? And I think based on some discussions we've had regarding herd immunity, until we get to 70, 80% of the population either being vaccinated or having had COVID-19, I don't think we can have that discussion. I think for herd immunity, we really need those numbers up a lot higher. Maybe we'll get there by the end of the summer. I know that the CDC is going to be reevaluating certain things in September. So I think that's a reasonable timeline to look at our numbers again and decide that. In terms of community transmission, we heard that we're still in that kind of substantial category. Certain indicators that we're following are above a certain threshold, and I think you'd have to see all of those indicators below a certain threshold for a certain period of time, usually, probably 2, 3, 4 weeks. We could really consider further reductions in the mask mandate. But I think for now, the main thing I would say is outdoors, going without a mask seems reasonable. Indoors, I'd like business owners to be able to make their own requirements for their places of business. I'd be very interested to see if there are business owners in on the call, or Chamber of Commerce people, what they might have to say in this. I think that'd be good to know what the public feels about this these mask mandates. Thank you.
Thank you, Alex. Excuse me. Chuck, did you want to say something? I saw your light.
Oh, no, I was agreeing with Alex. Thank you. No, thank you.
All right, thanks. Stephanie, any more that you'd like to add to that?
I think I would like to hear from community members prior to providing additional details and trying to formulate an actual recommendation to the Board of Aldermen.
Okay, thank you, Stephanie. What I'd like to do then, a little unusual, but what I'd like to do is open it up to public comment. I'd like to put a time limit. Excuse me, allergy season, I'm afraid. Put a time limit of a couple of minutes, not knowing how many people are out there. Try to give as many people a chance to talk as possible, and we'll see how it goes. If we're not adding any new information and just rehashing the same old information, then I'll probably put a halt to that and go back to the doctors and reevaluate what we're talking about and what direction we think we should go forward in Nashua. Okay, so Bobby, you are our fearless leader at the board. Who's the first person who would like to talk?
So the first hand that I've seen is G. Joe. G. Joe, you can take yourself off of mute and help me, Michelle. G. Joe, you're on mute.
hear me now?
Yes.
Yep.
Okay. Hi, everyone. I'm a longtime resident of Nashville, and just following the update as far as mask requirements. Yeah. I guess my question is, I'm seeing states like Florida and Texas lifting their, pretty much all the regulations and cases continue to go down. Massachusetts is just, I think on the 29th, they're getting rid of the mask mandate indoors. I know there's still a question about the showing proof of vaccinations. That's always occurred. But I'm just wondering what your thoughts are about continue to show metrics with the no restrictions at all before
Mr. Joe, you were going in and out. That last statement, you'll have to repeat that for the board.
Okay, I'm sorry. I guess my question is, since Florida and Texas, two of the big states that have eased their mask mandates and a lot of the requirements, and they continue to see numbers going down, is it something that Nashville is going to maybe take a lead on and then just show an example for the rest of the states that this can be done, and relieve some of these restrictions so we can get back to life as normal?
Thank you. Dr. Sturz, the next hand is from Christopher Weir.
Yes, can everybody hear me okay?
Yes.
Excellent. So I am a business owner in Nashville here, and I'll try my best not to repeat anything that's already been said here. I have been saying since day one that my biggest concern as a business owner is that I believe it should be a choice of the business owner to make such decisions. The customers and my business being in business will be dictated by others' feelings on this. If people are too scared to come into a business where someone is not requiring masks, that will obviously affect my business, and then I will have to make the decision to require masks. So that's number one. I think number two for me is we're kind of losing sight of the end goal here. We've gone from a situation where we wanted to prevent overloading hospitals, which was completely understandable, and a situation where we didn't understand a disease, to a situation where we have a very strong understanding of the disease, and now we are trying to obtain 100% vaccination of a population using an experimental vaccine, using an experimental technique giving a vaccine. And what is honestly sickening to the end is that we're now incentivizing people to take such a thing. But that's a separate topic. My end point is no further than what I've been saying since day one. It should be the business owner's decision to make a policy mandatory or not. There has never been a time where I or any other business owner would say, you absolutely cannot wear a mask in my business. That would be a ridiculous statement. There are going to be individuals who wear masks now and forever, regardless of vaccination. I think if the board and the aldermen continue down this path of kicking this can down the road, we're going to run into a boy cried wolf situation where we've asked for your help in this, we've asked for your advice on this and your expertise on this, but in the danger of you having an echo chamber effect where obviously all the medical individuals are very educated in that field and they want the absolute best, I think we need a better balance of how to apply that in the real world in a realistic way. I think it's kind of become an echo chamber amongst the professionals hearing themselves all agree, obviously. Does that make sense to everyone?
Thank you. I gave you more than the 2 minutes allotted. Next person.
Thank you.
You're welcome.
The next hand is Mr. Solian. Matthew Solian, you can take yourself off mute.
Yes. Hey, good afternoon. Again, my name is Matthew Solon. I'm a resident of Nashua. I've been here since 2013. I would like to just state that I believe that it is time that the city of Nashua end the mask mandate. This is based on the latest guidance that came in from the U.S. Centers for Disease Control and Prevention, where they have guided that people who are fully vaccinated no longer need to engage in social distancing or the wearing of face coverings. I think that the city should align to that standard that's been set by the CDC based on the scientific expertise that the CDC has and their better understanding of the COVID-19 virus. I'll also note that I believe the president of the United States even came forward and said that, we're moving forward with this latest guidance that the CDC put forward. It doesn't make any sense that you've got a scenario in which people in Nashua are having to continue to wear masks, even if vaccinated. But when they go to a neighboring town, they go to Hudson, Manchester, etc., they don't have to do that. Also, neighboring Massachusetts, effective the 29th of May, is going to no longer require people to wear masks. So I think it's time that the city of Nashua look to move forward.
Okay, thank you. Next.
Alderman O'Brien.
Thank you, Director Bagley. I just want to provide not an opinion, but facts and information. This current debate is being brought up at the State House. I don't know if this board has been aware of it or not, but it comes under the guise of Senate Bill 155. And right now is non-germane amendment. I'll give you the number, 2021. 144-3H, that I think you'll find interesting. We had a meeting yesterday. Testimony went from 1:30 in the afternoon to about 5:30 last night. It seems most of the testimony is going along to what the previous gentleman, leave it up to the basic businesses. But the crux of the matter is vaccine passports. And if I was going to bet on the Preakness or any other race, that's a horse I would not bet on. So just to give you that information on my opinion from the state. And that's it. Thank you.
Thank you, Mike. Next.
Mr. Pilla.
Yes, as a longtime resident of 20 plus years, I agree with most of the comments so far. So not to reiterate, but I know that businesses are going to be hurting because I know my adult son and several other people who will not shop in Nashua. They will go to neighboring towns where masks are not a mandate, and therefore it is hurting our businesses. Maybe not as much as Massachusetts, which had a lot stronger mandate, but I think we should ease the restriction and allow the business owners to make that decision. And I myself will only go to businesses that do not require the mandate. I may wear the mask, I may not. That is my personal decision, my personal choice, and I think it should be up to the businesses to make that decision. Thank you.
Thank you. Next.
Mr. Andrew Kay.
Hi, can you hear me?
Yes, sir.
All right, perfect. Thank you. My name is Andrew Koch. I've been a Nashua resident for about 6 months now, and I'd just like to thank everyone and the Board of Health and the Aldermen for having these meetings that we can participate in. I'd just like to say that the CDC has really gotten us to where we are through this pandemic. They've imposed recommendations that we wear masks up until this point. We've worked very hard to get vaccinated, to get a lot of the community vaccinated, and a lot of us, like myself at this point, are vaccinated. With their recent recommendations coming from that, vaccinated people have a very low risk of getting the disease, transmitting the disease, and an extremely low risk of hospitalizations and deaths. I'd like to see that we continue to follow the CDC recommendations where masks are no longer required except in those situations of public transportation, those really crowded areas. But for indoor situations, I'd like to see that our businesses do have the right to make that decision, and then the citizens of Nashua have a chance to choose businesses that they want to go to, and that mask factor may be something that's in that decision. So I'd like to see these mandates start to lift, or at least have some type of end in mind, and return to normal as we continue to get vaccinated. Thank you.
Thank you. Next.
Ms. Dyer.
Hi, Hi, yes, thank you so much for taking my comment. I did have one quick question. So I'm not sure who could answer it, but it has to do with the dashboard and showing the vaccination numbers. So it says first dose, the amount of people, and then it says people that are fully vaccinated. Are the people that are fully vaccinated, is the one dose persons included in that, or are they totally separate numbers?
Good question. Is Angela still here? Or Bobby, you could probably answer that.
Yes, Angela, are you still here?
Yeah, I'm still on. So could you repeat the question?
Sure. So on the dashboard where it's listing out the vaccinations, it lists a category for people who have received a first dose, and then it has a category for people that are fully vaccinated. Is the fully vaccinated category also combined with the first dose people, or are they entirely separate?
So they wouldn't be considered fully vaccinated unless they had received one dose of Janssen or 2 doses of Moderna Pfizer. So first dose are first dose only, and Janssen isn't included in that. That's included in fully vaccinated.
Okay, so both those numbers are entirely separate.
They can't be added together.
Okay. So, I mean, if we look at where we're at currently with the vaccinations, the dashboard today has, over 700,000 people that have had at least one dose in the state. There are over 500,000 that are fully vaccinated. And there's also 95,000 people in the state who have had the virus and recovered. There are, as of the last census, there was like 1.36 million people in this state. I mean, we're getting really close here. So I'm asking as a Nashua resident for my entire life for you to really look at that and see how far we've come. And I'd echo the sentiments that Andrew, that made previous to me, that it should be a personal choice. And I understand where public health is coming from and wanting to protect the public, but somewhere along the line here, we missed the leave it up to your own personal choice. And people have been doing the right thing. It's been, 14, 15 months. And look at our vaccinations, look at the recovered. I think we're doing really good. And that's all I wanted to say. Thank you.
Thank you. Next.
Mr. Rosenberg?
Hi, can you hear me okay?
Yes, sir.
Perfect, thank you. So echoing the sentiments of previous comments, I'd like to see the mandate lifted for 2 main reasons. One, I think if you look at our local COVID data on the city's dashboard, I mean, I think it's pretty safe to say at this point that we have a substantial data set here to show that the mask mandates haven't been super efficacious in their intent. I mean, they didn't stop the first wave back last spring. We didn't see a slowdown in the winter, and then we just saw an uptick in this past month. So it doesn't seem to make a super bit of difference. It seems to be a very, very seasonal illness. I think the data shows this and bears this out. And second, I think that if we're trying to encourage as much vaccination as possible, I think without giving people the feeling that they're going to get their normal lives back if they take this with the continued mandate. I mean, this seems to be not a great incentive for people to get vaccinated. If you're going to get vaccinated and then you're told, well, you still have to wear a mask indoors anyway, that doesn't seem to be a huge benefit, particularly for those who are on the fence of this. And I myself am vaccinated, and I'm going to live like I'm a vaccinated human being. So that's what I have to say on the matter. Thank you for the opportunity.
You're welcome. Next.
Mr. Appleberg?
Yes, good afternoon, everybody. Mike Affelberg with the United Way of Greater Nashua. So essentially, the environment that we operate in at United Way is very similar to a small business. We are a public-facing business where we do have members of the community walking in the door all the time. And we also are a place where a lot of meetings take place. So we've been thinking a lot about this in terms of keeping ourselves, our staff, and the public that we serve safe, just as the small business owners who've spoken do as well. I will also say that as an organization that's handed out some 300,000 face masks in the community, this is definitely an interesting topic to us. I would suggest that whether we have a literal mask mandate as an ordinance in the city of Nashua or not, that we are going to very quickly have de facto no ordinance in the city of Nashua, because the behavior that we're seeing very quickly come about is that people are looking at what is being recommended federally, what is being recommended at the state level, and what's being recommended in local neighboring communities as dictating the behaviors that they want to follow. So in Nashua, my concern is the same, I think, as everybody else, is we're now effectively really going to be on the honor system. People are going to walk in the door, whether we have an ordinance or not wearing a face mask. And we're already seeing that. And I think probably every business owner in the community is seeing exactly the same thing. Then you have to ask, what do I do? What do I say? How do I behave? Because I know that person who's walking in with a face mask, do I assume that they are vaccinated or that they're not? Okay. I'd like to see us focus our efforts not so much on the issue of an ordinance, but on a communication strategy. How do we as a community build a culture of health that encourages people to do the right thing, that encourages people to really understand and take to heart the guidelines that we have, so that when they walk into a space that's indoors, that they actually have taken to heart and said, I'm not vaccinated, okay, mask on. And it's as simple as that. I am vaccinated, okay, mask off. Or I am vaccinated and I still feel comfortable wearing a mask. And of course, that's okay too. I think we need to focus on the culture and the communication more than the ordinance, because I do believe very quickly the ordinance itself will be just words on paper and not really something that's going to be enforced in our community. And I'm already seeing that. Thank you. I know I've taken up more than 2 minutes, but I appreciate your time and your deliberation on this.
That's okay. Thank you. Next.
Alderman Laws?
Thank you, Director Bagley, and thank you to the previous speaker, because you articulated what I was going to say probably better than I will. I wear a few hats in this community. One is as alderman, that's how you know me. And the one that most of you don't know me as is the bartender at Beauche's on Canal Street. And I can tell you without a doubt, we were the most strict bar when it comes to enforcing the ordinance that we had. And I know that because people told me all the time. They'd come in and say, wow, you guys are really strict about this. The way I looked at it was, I mean, first of all, I didn't want to be a hypocrite. I'm asking people to protect themselves and their customers as an alderman. And second of all, it's a law, it's like showing up to the bar when you're not 21 and asking for a drink. It's just, you're either enforcing the law or you're not. Well, the problem with this ordinance is that many places didn't enforce the law at all, and there was no enforcement from the local government. And so businesses that like the one that I work at and a few others that I'm aware of in town, they basically just got hung out to dry, because customers could go anywhere else and not have to adhere to as many policies and rules as they did at our establishments. And when they were at those places, there was no consequence for it whatsoever. It was just willy-nilly, like the pandemic was never happening at all. So where I'm coming to you today is to say, private citizen Brandon laws, if there's no enforcement for an ordinance, then there's no point of having an ordinance in the first place. And I would, as Mr. Appleberg said, I think that our energies would be much better suited if we were focusing on just changing the conversation and encouraging better health practices than we were about, talking about an ordinance that's not going to be enforced anyway. So, I mean, a lot of people have been suffering a lot for the last year, and they've been very patient, and we've been waiting, and, you can see the light at the end of the tunnel. At this point, I mean, I really think we just need to leave it up to the private business owners and community members and hope that they do the right thing. So thank you. And thank you, by the way, everyone, for all of the tough decisions and hard work that you've made over the last year. Appreciate it.
Thank you very much. Sorry. Next, Bobby.
Miss Hale, Eliza Hale.
Yes, thank you, Bobby. I am also a Nashville resident, and I am just here to voice my concerns and my opinion. And thank you so much for having this meeting today. It's been about 30 days since the governor removed the statewide mask mandate, and as of today, like Angela had said, within the city of Nashville, there's about 209 positive cases per 100,000. And in the rest of the Hillsborough County, the average is about 136 per 100,000. And we're the only city in Hillsborough County that has a mask mandate. Logically, to me, if this mandate was working to prevent the spread, wouldn't it make sense that our positive cases would be lower than the rest of Hillsborough County? It's just, to me, it doesn't seem like it's what is really keeping it at bay. I'm here today requesting that the Board of Health advise the aldermen to end the mask mandate in the city of Nashua. I understand that it's the board's job to set up guidelines in order to keep the people of Nashua safe, but not mandate. Citizens, but not government, should be deciding their best health practices. Businesses in our city are certainly suffering. They're definitely offering their customers. I know I'm not alone in saying, just listening to these other folks here, that I personally leave the city to spend all of our money that we earn to support businesses that have offered that mask choice. And I just feel like this has gone on for long enough. We're entitled to our freedom of choice, and many people in our history have fought for those rights. So thank you for your time today.
Next, Bobby.
All right, and the last hand, Dr. Sturz, is from Mr. Ray.
Okay. I understand the desire to get back to normal. I would love to get back to normal. But I think that getting back to normal, each time we've done that or tried to do that, that has led us to more cases. I remember last summer when people said, well, just tell the kids to go back to school. And the cases went up. And when we told businesses, just go back to work, and the cases went up. So I'm not trying to take away anybody's rights, but I know that we have to have vaccinations before we go to schools. I mean, we don't tell the kids it's their choice whether or not you want to have a vaccination. So to me, and the other thing is sometimes we misquote what the CDC said. The CDC said you didn't need a mask for outdoors, but it did mention about needing one for indoors.
Yeah,
So
dude.
I just recommend caution. That's where I'm from. I recommend caution, and we will see what happens. We will see if once again the cases go up. I hope they don't. It's not just gloom and doom. I hope they don't. But I advise caution, and I realize my time is up, and I'll let it go.
Thanks, Ray. Appreciate it. Bobby?
Dr. Sturz, we have Alderman Lopez has his hand.
Okay. Tom? 2 minutes.
Thanks. I don't want to get into the trap of trying to advise you as to how to advise myself later on the board. I just had a constituent contact though, who's not comfortable speaking in the meeting, who wants to point out that not everybody has the same access to transportation or vaccination. So while people may be free to go to different places to choose who to support as a business based on their values, we do need to make sure we protect the right of businesses here that want to protect patrons that don't have as much mobility or choice.
Thank you, Tom. Anything else? I think he's off. Bobby?
Nope, thank you.
Okay.
Dr. Sturz, I don't see any more hands at this time.
Okay, thank you, Bobby. What I'd like the members to do after their long and hard thought process on what's going on, listening to the public, relying on their personal and their professional opinions to start formulating, or I can put it forward to you and then you can vote on it, what you would like to do as far as the mask ordinance in the city of Nashua. Stephanie or Chuck, either, whoever wants to go first.
All right. Yeah, thank you for the public comment. It was phenomenal. It was great. There is something for those who hadn't seen from the Bureau of Infectious Disease that was passed along, which following CDC guidelines, it's a graphic about indoor activities and should I wear a mask and physically distance? And there's a graphic of a person wearing a mask indoors if the vaccination status unknown or not fully vaccinated. So that's directly from New Hampshire Department of Public Health Services, which aligned itself with the CDC. So comments around we're not following CDC guidelines, I would just, just respectfully submit that there are, this is a ongoing process, and even at the level of the experts, that can be confusing. So I don't disagree with the public's comments, and as a public member too, it can be wary. But I echo some comments prior that, it's a leap of faith, especially when we're indoors, we all, the medical people, and we all in this public realm, trust each other to do the right thing. And I'd like to think that everyone does it for the sake of everyone else, but sometimes it doesn't always work that way. So I think the culture one, focusing on culture, is a great comment. I like that comment. And hope you do the right thing was another one. So I think we're all echoing a sentiment that we want to get to, but I would start with, the incremental changes that have made so far in a year, have been phenomenal, but I medically would say that we're not to the finish line yet, and that may go against the grain as a salmon swimming upstream. But I think we still have to hold on to some reins here for a little bit longer.
Okay, thank you, Chuck. Stephanie?
Well, first of all, I want to thank all the members of the community that have expressed their opinions. This is something we take very seriously, and we definitely, try to ensure that we come at this from different angles, as not only as healthcare professionals, but also as citizens, as working persons, as patrons, as parents, as grandparents, and so forth. The job of the Board of Health is to make recommendations based on science. And it is with great sadness that I hear people talk about their struggles in terms of trying to find locations where they feel safe, but also a feeling that the mask mandate was not enforced and may have led to unfairness. It's important that people recognize that the job of the Board of Health is not to respond to how people may follow the mandate or who might enforce the mandate, but rather to make, to make recommendations based on the science and based on what can protect persons. As has been brought forward, there are other decisions made for the purpose of public health that do not necessarily generate complete freedom of choice for all individuals in instances where those choices might affect. We've been through this, whether it's vaccinations in the schools or smoking in indoor environments. So there are many, many examples one can find through decades and decades of public health where the best decisions made on the science may limit some choice. And I think if we're going to focus on understanding and cultural and mutual respect, it's important to note that some of the types of decisions that have been brought forward that may limit choice are not unique to the COVID-19 pandemic. I would also say that there's been a great deal of information brought forward by the various comments that, while well-intentioned, does not reflect the science. For example, there is no question that masking limits transmission and protects persons. There has been controversial literature about this, but unquestionably masks do protect others and do protect yourself. And I think that under the guise of making sure it's important that people make informed choices for themselves, that it's important that people do understand that. Also, that the vaccines are safe and effective, and very effective compared to what the criteria were. I understand people have vaccine hesitancy, and in no scenario did anyone ever contemplate 100% vaccination. Likewise, in no scenario would the kind of vaccination rates that have been spoken about today, even with some persons having been positive for the COVID infection, lead us to be in a protected environment where transmission cannot occur. It is true that a number of states have lifted their mandates, but I do not think we have sufficient information to say that that has created an environment where there are no safety risks. And that has to do with a number of different factors, including how much testing we do. I don't want to lose sight of the fact that COVID-19 is an extremely dangerous infection, and that a vast majority of persons who do become infected have some long haul symptoms that may last for 6 or more months and lead to long-term debility, including in children. So if we do recommend today to lift the mask mandate for reasons that we have stated, I think it's critical that all the concerned citizens on this call, all of the business persons that are in a position to educate, make sure that people understand that if you are in environments which, as Dr. Granick has said, where you cannot be certain that all persons are vaccinated, that people take all precaution. And I think that with those remarks in mind, I would like to defer to Dr. Granick to elaborate further on any of the comments the public comments that have been made, so that we include all, for educational purposes, all relevant science.
Alex, would you like to comment?
Yeah, a couple of quick comments. There was a public health person, I think she's from the state of Illinois or Chicago, that when public health measures work, it's very unexciting because nothing happens. And anytime you see a decrease in rates, you never know what would have happened had the flip side occurred. Had we not instituted a mask mandate, had we not started vaccinating, I can almost guarantee, no one's 100%, but I can almost guarantee we would have seen a lot more hospitalizations and a lot more deaths. So just the fact that you didn't see anything happen and we still had cases, it could have been a lot worse. And I think there's pretty good evidence that it would have been worse. I think, what I would suggest is, and I do agree that lack of enforcement really hurts any kind of mandate like this. I think, as another person said, that we know that there will be a de facto lifting of the mask mandate because of human behavior. If someone says you don't have to wear them, well, it's much more comfortable to just take off the mask and not worry about it than it is to have to worry about where your mask is. So with that realization, since it's coming at us from multiple directions, I think it would make sense that we start from kind of the inside out, that we see these are the situations where you still need to use a mask, no questions asked, public transportation, healthcare settings, et cetera. And we need to give private business owners, it's their business. They should be allowed to say, if you want to come in here, you have to wear a mask, or we don't require a mask for entrance, and let people segregate where they want. If they feel more comfortable in a business that requires masks, they'll patronize that business. If they would prefer not to, they'll go to another business. But I think if you're going to do that, my recommendation is that it has to be enforceable. That the business owner needs backup. They don't want to be the policeman behind the bar with the bat. They need to be able to call for public help and get the person removed from their business if they're not following their own recommendation. So that's what I would say. My suspicion is that we will see higher rates. and it will be among unvaccinated people for the most part. I think people just need to recognize that. We didn't get anyone else who works in healthcare on the line, but I don't want to go there again. It's not a pleasant thing to have every bed in the ICU filled with COVID patients. And I'll sign off there.
Thank you, Alex.
Tony, could I add 2 more points?
Sure.
Okay, thank you. One is someone said that it is a seasonal virus. And what I would point out is that it is very warm right now in India. And they are having such bad surges that they have run out of oxygen. So I want people to be able to make their decisions, but they also need to make it based on information that is the best information we have. And we do not have information that it is seasonal at this time. And I also want to reiterate something that was said about the present CDC guidelines, which do state that if you have not been vaccinated, you must wear a mask that covers your nose and mouth and stay 6 feet from people that do not live with you. Thank you, Tony.
Thank you, Stephanie. I'd like to first off thank everybody, also the public that recognize and appreciate the work. I don't think any of us thought back in January, February, March that we would be here in May and still talking about this and still going in that direction. I'd also like to make a comment. We are here because of public health and not in spite of it. Comment was made regarding what we're doing doesn't help. It would be actually worse. What I'd like to propose is just read this statement for basically for the members of the board and for the public, and then open discussion on it or vote on it, whatever you feel is your wish. In light of the recent changes by both the state of New Hampshire and the CDC, the Board of Health would like to advise the Board of Aldermen to modify the national mask ordinance. Our recommendation is to allow fully vaccinated people to go about their business without the use of a mask, unless they want to wear one. This would mean for them both inside and outside. We highly recommend those vaccinated. Excuse me. We highly recommend those unvaccinated to wear a mask for their own protection and that of others until vaccinated or until the appropriate health organization deems it safe not to wear one. We ask that the people traveling on public transportation or in tight quarters to wear a mask. Example of this would be buses, trains, planes, and of course, healthcare facilities. If the current health situation changes, we reserve the right, the ability to change these guidelines accordingly. And we will continue to watch and monitor the statistics. In regard to local businesses, we will leave it up to their discretion on protocols for their establishments. They must weigh the risks of protecting both the patrons and their staff. If they feel they want to continue to wear masks, this would mean both vaccinated and unvaccinated people must comply, as they would have not had any way to safely distinguish between the two. Chuck, Stephanie, feel free to jump in, amend, throw it out, whatever. I don't have a big ego, so do what you want to do. Chuck?
Well, I think I mean, we've, as I said, and I don't mean to sound like a broken record, but we've come a long way. The race isn't over, but to go this step and to say now from a group that we were highly on the fence of taking the mask at all, to say that we'd like to lift it is a huge step in a direction. And but then secondly, to allow the business owners, which we all patron, the chance to make that personal choice. I understand that, respect that, is it's up to them. So do I think that's the safest route? I probably medically would still say no, but I think given the guidelines which we have or what you just read, I think we do have to worry about those that are saying they're vaccinated when they're not, and focusing on the culture change. But but promising the public that as each month goes on, our vaccination rates go up, our positivity rates potentially go down, that in 3 to 4 weeks from now, we can have the same discussion and then revisit this. So this is a moving target, and, it's not the end, but it's definitely getting to a place that I hopefully think the public understand where we're coming medically, and yet allowing them some choices here, despite, maybe other people who disagree.
Thank you, Chuck. Stephanie?
So I agree in principle that is the correct recommendation to the Board of Aldermen. I would strongly urge that we include language that states, as it does in the CDC guidelines, that people who are not vaccinated are recommended to avoid crowds in poorly ventilated indoor spaces due to the increased risk of getting or spreading COVID-19. And that all people who have a condition or taking medications that weaken their immune system take all precautions, including maskings in all settings where they cannot maintain distance because of their risk of getting the disease.
Stephanie, I have no problem adding that to the language. Seeing that, I would like to see a recommendation to move the resolution from either Stephanie or from Chuck.
There are two persons that have their hands raised.
Yes.
All right. Go ahead.
Alderman Lopez and Alderman Laws both have their hands raised. Alderman Lopez's hand was first.
My apologies. You're not on my screen.
That's okay. I just wanted to clarify because of some previous comments that inferred that enforcement was, someone made a comment like a business needs to be able to call the Board of Health or the Department of Health to enforce. While the Office of Environmental Health will provide guidelines for restaurants and such businesses to operate from a health standard safety, when we as aldermen enact approve an ordinance or create legislation, it is not our responsibility as aldermen to actually enforce it either. It is the police officers' responsibility and the police departments. We did consult with them thoroughly in creating the mask ordinance and regularly. We were assured by them that any city ordinance would be enforced fairly and regularly as appropriate by the police. So if business owners feel like they were not getting appropriate enforcement from the police or appropriate response, that is something that should come to the attention of the Board of Aldermen to a point, but it really should be brought to the police commissioners because they oversee the police.
In the face.
I'm guessing that was somebody talking to their kid.
Yeah, please, if you're not talking, sorry, Tom, if you're not talking, can you please?
That's okay.
I appreciate it.
And I heard a kid laughing, so I'm assuming there isn't like a crisis going on. But that is, the Board of Aldermen doesn't oversee the accountability part of the police department. The police commission does. And there is currently legislation in place for the citizens to decide whether or not they are satisfied with that level of accountability or not, whether they would like us to expand the board, the police commissioners, appoint leaders locally instead of having it being done at the state level, all of that. But it's important for people to know where those roles are. The Board of Aldermen do not run the police department by intent. That's the police commission. So if you feel like you see a law that's being violated, any ordinance, you should report it to the police. If you feel like the police are not satisfying you, you should go up their decision chain. And if you feel like you're not being heard by the department itself, then you should talk to the police commission. And if you need an ally in that, then you can talk to your alderman and we will participate in that conversation, not to influence it, but more just to support you in that process. Thanks.
Thank you. I just want to correct one of the things you said, which was probably just a slip. The Board of Health and the Public Health Department do not enforce. We have no enforcing ability. So you are correct. It would have to go to the police. The next person, hand up, Bobby.
Alderman Laws.
Thank you. And just to carry on from what Alderman Lopez was just saying, I hope I didn't come off implying that it was your responsibility to enforce this. I was saying the local government hasn't been supporting businesses that have been following the ordinance. That being said, just a matter of procedure, with your recommendation, I'm not sure where the contact tracing falls into this. And I know certainly in my business, we've been doing it all along. I'm not sure if we're supposed to continue doing this or, so, I mean, if you can give some guidance on that, I'm sure.
Will do. The basic, this is kind of the backbone of what we're doing, and there's going to be some things, arms and legs added onto it, but we will take care of that. Bobby, I know Stephanie, but I think there's somebody in front of Stephanie.
Alderman Dow.
Yes, I sort of concur with the direction you're going, and certainly we want to apply the wording to the legislation that comes from the Board of Health, and I'm sure the Board of Aldermen will support your decisions. I think that it's heading towards the same recommendations that's coming out of the CDC. The one thing I would suggest is that the wording be clearly put in writing, and you work with Corporation Counsel so the legislation can reflect exactly what the Board of Health is recommending to the Board of Aldermen, so that we can have a meaningful debate on it. Thanks.
Yes, sir. That's why we have Attorney Bolton sitting in the wings, eagerly awaiting what our vote is, and we will work with him before sending it over to the alderman as usual. Bobby, anybody else? I think there might be one other person.
No, Dr. Stores, that's it as far as I know.
I saw Stephanie's hand go up. Are you okay, Steph? Oh, we lost her.
Can you hear me now?
Yes, ma'am.
Sorry about that. Oh, now, ma'am. I support and would like to move the recommendation with the understanding that Mr. Bolton will help us craft a formal recommendation to the Board of Aldermen with all appropriate language that the mask mandate be lifted, but that it be accompanied by the information that has been shared, so that we are all of us as citizens, as Board of Health members, as Board of Aldermen, are sharing the same information. I would like to add one additional thing to what I said before, and it harks back to something that Alderman Lopez said about one of his constituents that did not feel comfortable to speak today, but since it is our goal to represent all citizens, I would say this. I would strongly urge, as part of this, that we urge essential businesses to create protected environments. Throughout the pandemic, many of the grocery stores had special hours for senior citizens before there were vaccines that allowed them to go and feel comfortable that there would be masking, and that persons would be especially careful. And I think that we should promote that be continued for those types of essential businesses.
Thank you, Stephanie. Stephanie's moved the motion for rescinding the masks with the other recommendations. Looking for a second. Chuck, second. Those in favor?
Aye.
Unanimous. And the next step will be working with Attorney Bolton and Bobby to put together something presentable to the Board of Aldermen. Okay, I'd like to thank the public. I know this has been hard. I know it's been grueling. I know you've done a lot to sacrifice to get us to this point. I appreciate your trust in us. Let's hope we never, ever, ever have to come back here, and let's hope we've learned some lessons and this never, ever happens again. Thank you, everybody. Thank the aldermen for their input as well. We have one other item of business. Chuck, I know you have to take off. Are you crunched too much for time?
Well, I'm good. Thank you. Thank you.
Okay. The second item on the business, which I've lost my agenda, is the chairman has a chairman's fund that he or she or whatever gets to use that money appropriately. That money's been sitting around for a while. We really haven't had anything significant to do, but we have spent some money in the past on different things for the city. I would like to propose that we take $50,000 of that money and form a scholarship for Nashua students who are interested in becoming a public health nurse. We can, if you, just to sweeten the deal, if I can make you feel that this is an important thing that I feel, I will match that $50,000 with $50,000 to make it a $100,000 scholarship to be used. We have people that invest that money for schools and things like that. And the interest will be given to a student or students, but the principal will always stay the same. So it'll be a perpetual scholarship. So that's my proposal. Chuck and Stephanie, if you'd like to ask some questions or tell me to get lost, whatever.
No, I think it's a phenomenal example of getting the leaders of tomorrow out in the real world. And public health is, as we're learning here, you know, for me too, it's a learning curve the last 7 years I've been on the board. And just to see what the people in the trenches do every day, what we don't appreciate happens behind the scenes. This is a phenomenal opportunity for everybody to, you know, take this and run with it. So I would think it's an amazing proposal, and I hope not only just you know, the public school kids, but maybe the private schools, but you know, thinking about who's eligible would be the next step. But I think the idea in principle is just super.
I can tell you, you get to write the framework of it before you establish the scholarship. And there's certain things you have to have an arm's length separation. You can't pick the people. There's an independent group that picks it based on what your guidelines are. And that's kind of how it goes forward. Stephanie, any comment from you? Oh, and the other thing before you do comment, we also have to check with Steve. Can we do it? Is it a doable thing? Stephanie?
Is Steve there?
Yes.
Yeah.
Go ahead. Yeah, go ahead, Steve.
I think it's incredibly generous of you, Mr. Chairman. And there are things to be worked out, but I'm sure it can be done.
Great. Thank you, Steve. Stephanie?
There is a nursing shortage. The average age of nurses in the United States is in the 50s, and the nursing shortage has been exacerbated by the stress, strain, and the number of the pandemic, as well as the number of healthcare providers that have become ill or unfortunately have succumbed to COVID. And so I think that anything we can do to protect this important, incredible resource for the future is of extreme value. And I commend you.
Thank you. I'm just looking to repay the city that has given me so much. And I agree with you. Nurses are kind of our line of defense, and we need more and better. And I hope that this will help. Looking for a motion to move this piece of legislation.
Yes, I motion.
Chuck, seconded. Those in favor?
Yes.
It's passed. Because it's a special meeting, we can't really talk about anything else. I'd like to thank everybody for all their input, whether you agree with me or whether you don't agree with me. It just shows the testament of a democracy where everybody can step up to the microphone and speak their piece. And hopefully we're all doing the right thing for as many people as we can. Thank you very much. I'm looking for a motion to adjourn. Stephanie, and seconded by Chuck. Those in favor?
Yeah.
We are adjourned.